the HSX at the heart of it is an interoperability company. I mean, that they're just trying to connect all these disparate systems.
This is becoming real in your region.
Having access to this kind of information is paramount.
I think that's unique in this market is we're looking at some clinical challenges and employing the technology to solve those.
For us to know more about what's happening with our patients, as well as making sure that hospital systems know more about what we've done for those patients and not repeat tests and as they go from ER to ER.
People, they know fragmented healthcare and they know continuity of care when they see it. We just have to provide that link. So the success of this, or the uniqueness of it, is the partnership with the payers and the providers. So that's a key facet of this model. You need to see it live, but you also need to be able to express what this means to people.
The HSX is going to receive a message from Mainline Health's ED saying that John Sternlieb is sitting there, and also a message to the ACO. This is incredibly powerful. So now we're back into the ED again. So in the Mainline Health ED, you can see I have a message, but the summary of it is that there's a lot of empties. There's probably about 15 diagnoses there. The relevant ones are he had a benign neoplasm in the past. He had a post-surgery, so he had some surgery in the past. So now we've seen the patient. He looks good. He's not really very coherent. We decide that because he's got a laceration to his head, it's probably a good idea to do a CT scan of his head. And we'll go look through his home medications, and we'll take a look and see if there's anything that we need to worry about. And so with the discharge instructions Jamie's working on here, he's putting in the diagnosis. And so these discharge instructions will get sent through HSX back to the PCP.
What happens with my workflow is that the document related to both the notification as well as the clinical information comes into my electronic record. My office staff opens it, they do their process, they route it to me and say, we've reached out to this patient, he's coming in on Friday. This is real and this is happening every day at Crozier Keystone Health System.
We're better off for having the information, and I think we're better off that we have everybody working together on it. It's a lot less expensive, I think, for us to do it this way.
The process that we follow then allows us to track and really identify our highest risk patients.
Most of our members get their care in more than one system. The data doesn't flow today, so we can connect that. That's really fundamentally different than most HIEs, the way they're set up. The concept here is connecting everybody so that information flows.